Hi, welcome to the Age Management Show.
I'm Dr. Ali.
And I'm Dr. Sam. Today we are going to be talking about conventional medicine versus alternative medicine and how age management medicine falls into that.
So maybe we should start by looking at the term medicine. What do you think?
Medicine, the word, does not refer to a pill or a potion or surgery. It can be a number of things. Sleep can be your medicine. Exercise can be your medicine. Your food can be your medicine. Your ability to manage stress can be your medicine. Anything that makes you better, makes you healthier.
That brings the body back to normal.
That brings your body back to the normal state is medicine.
So it may actually be multiple things. So it may be food and a pill, or it may be exercise and food and stress management and a pill. So it can be a combination of things as well. It may be surgery and a pill.
Or it may be no pills.
Or it may be no pills, right? It may be just a surgery, or it may be just exercise. So all of these can be therapeutic, and they are considered to be medicine. Now, medicine, yeah.
Well, tell us about conventional medicine.
Well, medicine currently seems to have become polarized and fallen into two camps. There's the conventional camp, and there's the alternative camp. And kind of like politics, they aren't so friendly. They each have things to say about each other. But let's start with conventional medicine. So conventional medicine is what you would find in most doctors' offices around the world. Mm-hmm. This is based on Western scientific discoveries. It's an attempt to normalize the human body, whether it's to normalize certain markers that you find in the blood or in the history or whatever, or to normalize parts of the body, such as a broken bone.
So it's usually when something breaks down and then we give it a label, that's a diagnosis, and then we know what to do with that diagnosis. We know what the treatment is or the cure is. That's usually the basis.
Right. And there may be a testing phase in there as well, where they may test blood samples or urine samples or some little piece of the person to evaluate in what way are they abnormal, and then to label it, give it a diagnosis, and then begin to treat it. Mm-hmm. And another part of conventional medicine is that you tend to use more patented drugs. By that means drugs that are true and tested, that are approved by the FDA or Health Canada. And these are medications that have undergone trials and have been shown to be safe and effective, but they may have some side effects, but overall, they're safe and effective for their issue. It may also involve surgical procedures. Mm-hmm. So this is more of the conventional approach.
Mm-hmm. A combination of the above, one or two or multiple things most of the time.
Right. But the aim, again, is to return that body to that normal physiological state. So what is alternative medicine? So alternative medicine is usually medicine that is not conventionally practiced. It is a slightly different approach.
It has a little bit more of an emphasis on prevention, but also on treatment, on being therapeutic.
Right.
But the term alternative medicine has become a little bit of a controversy.
Well, it's designed to be a little disparaging, right? It's designed to imply things that it's not true medicine, it's fringe medicine, it's pseudoscience, it's unproven medicine, it's untested medicine, it's disproven medicine.
Or it's impossible to prove.
It's impossible to prove. Mm-hmm. And in some way, it also implied that it's harmful.
Mm-hmm. Mm-hmm. And that includes a number of different types of medicine, such as naturopathy, homeopathy, Asian traditions of medicine, acupuncture.
Right.
There are different approaches.
And there are attempts to even bundle and lump age management medicine with alternative medicine.
Mm-hmm. So, if why does alternative medicine still exist? Why has it not become obsolete if conventional medicine is the answer?
And that actually is the basis of why alternative medicine still exists, because if there wasn't a need for it, mm-hmm. why would it be there? Right? And so, when you start to look at the models and how medicine is practiced, you start to see that there are gaps in that conventional model, even though people feel very solid or very confident. Yes, exactly. Thank you. They feel very confident with the conventional model, but then there are gaps that are created. And some of these gaps include gaps in conventional, in the model, such as there's no prevention.
No or very little emphasis on prevention. A lot of conventional medicine is basically geared towards having a body part break down or be not at its original setting, and then we try to fix it, but we wait for that to happen. We wait for things to break down and then we try to fix them. There is a little bit of emphasis on prevention, but not a whole lot. It's mostly your doctor telling you that you need to lose weight and you need to eat right and go ahead and do it. So you're not given a lot of guidelines and resources as to help to do that.
Which is a major thing, because even for your car, you try to do preventive maintenance, you try to take care of the car to prevent breakdown problems, right? And why wouldn't we do that for ourselves?
Yeah, you wouldn't wait for your car to break down.
Exactly.
Before
right?
You
so before you find out that you should have changed the oil at 50,000 miles, and now the car has stopped. Mm-hmm. So we do that for little children because we have well baby care and that sort of thing. And I actually like to refer to age management as actually big baby care, where we're taking care of adults. And we're doing those sorts of preventive things that we try to do for children and we do for vehicles, but yet we don't do it for adults.
So that brings us to, what is age management medicine?
Well, before we run into that, there's a couple of other little nuances I'd like to mention about gaps in conventional medicine. Now, conventional medicine tends to be more of a piecemeal form of medicine as well, right? It's what we used to call the Kentucky Fried Chicken approach, where it's by the piece, right? Mm-hmm. So if you have an issue with your finger, you have a specialist. If you have a tummy problem, you have a different specialist. And everything is, taken care of by different specialists. And there isn't somebody looking at you as a whole person, although our bodies work as a complete machine.
Mm-hmm. Mm-hmm. We have a saying for that. So for family doctors, they say that we know less and less about more and more until we know nothing about everything. And for specialists, they know more and more about less and less until they know everything about nothing.
Well, that pretty much sums it up,
mm-hmm.
in a lovely, humorous way. And that's doctor humor, by the way. So, this is not good for, this conventional medicine is also falters with chronic issues. So with chronic issues that have to be taken care of on a long-term basis, it doesn't seem to work as well. And there are many of examples of this, such as diabetes, hypertension, and all these sorts of things that don't work on a medication-only model, right? They require lifestyle changes. And although conventional medicine does tend to give lip service to these lifestyle issues, it doesn't really promote them or focus on them. And it's more about, have you taken your statins? Are you on your statins? What's your blood pressure showing? What's your lipids showing? What are your cholesterol and all this? But you could be eating rubbish and not exercising and, doing all sorts of stuff and have a horrible lifestyle, but taking all your pills, and it doesn't really benefit you because it's not so simple that, there's no magic pills. And so this is another major flaw in this. And the last thing I want to mention is that although these conventional pharmaceuticals are quite miraculous, and we like to say that our lifespan has increased because we now discovered antibiotics and we have all sorts of medicines and all this sort of stuff, and they're absolutely wonderful inventions, advances in medicine. Having all these drugs, our lives are obviously not the same without them. But on the other hand, many of them tend to have horrible side effects, and you may end up having another problem from the side effects, or you may end up taking a medicine to treat the side effect from the first medicine, which then results in another problem for which you take another medicine. And by the time you're done, you're taking about 6 medicines for one issue, simply because the rest of them are just a cascade of side effects.
We call it fixing one thing and wrecking another. We do it all the time.
Right. And the technical term for it is you end up with taking lots of medicines, which is called polypharmacy. Mm-hmm. And then this has potential effects because some of them have individual effects in interactions with each other. Mm-hmm. And, so these can be an issue. And then they also can cause more problems that may even be worse than the original problem you started out with. Sure. So, and in chronic conditions, this is usually the case because, you have the older male or the older female taking, 10 pills every day or 20 pills every day. And most of them don't actually treat the original problem that they had, but they treat side effects or other issues. And so, we like to feel that there are, or we know, or we think that there are alternatives that have a gentler side effect profile, and these can accomplish the same issue without doing that.
So tell us about what is age management, and tell our listeners what is age management and how does that fit into this whole picture?
Well, see, as I mentioned, that there's gaps. There are gaps in the conventional model, right? And age management bridges the gaps between alternative and conventional medicine. And as I said earlier, they become polarized, they become separated, but they can't. They have to coexist because these are just different approaches, because they all have the same ultimate goal, which is to make us better, right? To make you better, to make you feel good, to make you your best, right? And so
alternative focuses more on preventing things from happening, but then if they do happen, conventional medicine is there to fix them. So each has its place, each has its role,
right?
And but there's that gap, like you said, in between, where the people where prevention is not completely working because it doesn't work for everyone, and they're trickling through. So before they get to that conventional side of things, so upstream, downstream, their age management medicine is kind of it helps to give you options in terms of what things you can do before you jump to the conventional side.
Right. So it has both preventive options and it has therapeutic options, which means it treats conditions that are already in existence. And also, as I mentioned earlier, you are a whole person, right? And everything is connected to each other. That Kentucky Fried Chicken approach, it works in a few cases, but as you age, then you have multiple problems, and they're all interconnected and linked. And they have hormonal ties to them. They have different issues, and so one has to look at the whole person, particularly if they're healthy, but they have just little bugs in their systems, right? I'm feeling tired, I'm putting on weight, my moods aren't good, I'm having reproductive issues, all these sorts of things. They're not life-threatening, but on the other hand, they're life-altering, and they impact our quality of life, right? And so you want to improve that quality of life. So you need to be looked at as a whole person. And for that, there's that term holistic, right? And it's used more by the alternative people, but you really need a holistic approach for you to be whole.
Well, like you said, some of the gaps in medicine, in conventional medicine, might be, when they're trying to put you back to being in that original setting, bringing things back to normal. So you may get treatment and your blood tests look completely normal. Your X-ray and your ultrasound looks better, looks normal, but yet the patient does not feel normal. You don't feel well. And there's that gap.
Right.
So your doctor tells you you're fine, but you're not fine.
Because you're not optimal, right? You want to be optimal. You want to be at your best, right? So those lab levels may not be adequate targets because they're too broad. So we tend to use, in age management, we tend to use narrower blood levels and narrower targets as your optimal levels, right? So this is, age management brings you onto the upper end of being normal, right? So you are treating deficiencies that may occur due to age or due to illness or due to some injury or trauma or whatever. But so you're still correcting deficiencies, which is what conventional medicine is also doing. But you're optimizing the person. You're optimizing
and trying to correct the deficiencies before they turn into diseases, before they turn into an illness.
Right.
Preferably.
Right. So this has been a criticism of conventional medicine, that it's more of a repair model rather than a prevent and treat and keep you healthy and well model, right? It's just repair medicine. And you have that lovely thing about eggs and repair.
Well, I still tell my patients that you can't put scrambled eggs back in the shell. It's a saying. I don't know, somebody quoted that, but think of yourself as an egg, and the longer you can keep yourself in your shell, the better. You may have some dents and cracks and bruises and scratches and whatnot, but the minute the shell cracks and you start oozing out, then you're on a slippery slope. So, and once you get to being scrambled, then it's really hard to get you back to your original setting. So the longer you can keep yourself within your shell, the better. And that is our focus, in combining the best of both types of medicine, alternative and conventional.
Right. So that's what age management does. It combines both alternative and conventional, but it is built on the same scientific foundation that conventional medicine is built on. So it's more of an extension of conventional medicine rather than using a different diagnostic and therapeutic and scientific model than as is the case in alternative medicine in some medical systems.
Well, yeah, it's based on science and it is based on your body physiology.
Right. And in fact, some of the products that are used to treat the deficiencies in age management medicine are essentially the same as the ones in conventional medicine, but they may have a different side effect profile because the molecules tend to be closer to the ones that we produce. And these are not, herbs from some unknown wonderful tree or bush that somebody found, and they're having a go at it.
No snake oil. No magic potions.
No magic potions.
No snake oil.
These are all FDA monographed, approved products that are either compounded or manufactured. And these are used to treat the deficiencies, to replace the deficiencies, and allow the body to move back towards normal. Because the aim of age management medicine and conventional medicine is, again, the same. As is for alternative medicine, it's to return the body to normal, because normal and optimal.
To fight entropy.
To fight entropy. So that's the aim, to do that. And it's just, this is just what our aim is to have a 360 approach, where we're using the best of all possible worlds.
Mm-hmm.
We're using medicines or treatments that have improved side effect profiles, but we're still using the same diagnostic testing, essentially the same therapies. And that's age management.
Same lab tests,
Yes.
same, X-rays, ultrasounds, that sort of thing. But it's interpreted perhaps slightly differently. And the approach is different in that we are trying to keep you healthy while you're healthy for as long as possible. And if you do run into problems, to give you options and choices on what things you can do in addition to what your conventional doctor instructs you to.
But there is one slight difference. It's very fashionable nowadays to throw about the term evidence-based. And evidence-based is a term that is based on trials and studies and that are done to evaluate these medicines. And the accusation is made that age management uses untried, untested supplements or medicines. And actually, that's not quite true. The products that are used are FDA approved and manufactured or compounded. And it is not, and it's true that not all of the cases are perfectly evidence-based, because it's impossible, because most of medicine, whether it's conventional or alternative or age management, is done through tradition. It is not done through evidence-based, no matter what people like to tell you, because you have multiple steps in the treatment of a person. It may have one medication, or it have multiple medications, plus you may involve some sort of, like anxiety, for example, mm-hmm. right? So anxiety will have, say, some talk therapy, some psychotherapy, in addition to anti-anxiety medications. And so this is a combination approach, but it also may include other lifestyle changes, such as stress management, such as meditation. And
so it's very difficult to do something called randomized, double-blind, placebo-controlled trials to get your evidence. Is that what you're
right?
You're
but this applies not only to age management medicine or to alternative medicine, but this also applies to conventional medicine, because there may be a surgical procedure that is done, but it's followed by a particular kind of rehabilitation or physical therapy, and the progress may differ based on the type of physical therapy that they received, or based on their nutritional status, or based on their supplementation status. So all of these.
So you can't do studies on.
Right. So they may imply, so while conventional medicine people may try to imply that, oh, this is all evidence-based and we have evidence for everything, it's impossible, because there's different pieces that have no evidence for, and they've just been done traditionally, mm-hmm. right? And even within those pieces, like physical therapy, there aren't exact evidence-based protocols. They vary from person to person, to school of thought, to all this kind of thing. And yet, it's an accepted part of conventional medicine that you do surgery and then you do rehab. And this can affect the outcomes. And the surgery may be similar or the same, but then the rehab may be different, and the patient may get different outcomes. So, these are, there are similarities of age management to conventional medicine, and as well as to alternative medicine. So where does it fit? Somewhere in the middle.
I would agree with that. I think it's everything has its place. Alternative medicine does a good job in a number of people, in a number of conditions, in prevention especially, and conventional medicine has a place as well, of course. And age management medicine fits in the middle somewhere to give you options and alternatives to things that are out there that you may have already tried.
On both ends, on the preventive side or on the treatment side. So it bridges the gap, and it should allow you to have better healthcare outcomes, and a better life.
Thank you.
Thank you.